Nurses are extraordinary, and they do extraordinary things, and we do it every day.
The opportunity that we have to make a difference in the lives of people is just so incredible.
It's really a service industry in the greatest sense of the word.
I went to a conference last week and there was a gentleman talking who was not a nurse, and he just asked the question, what does it feel like to be a member of the profession that's the most trusted profession in the world? And you know, it feels good.
I don't ever remember not wanting to be a nurse.
Every day a nurse goes to work, she's a part of a story. It's being a part of those stories that make nursing so rewarding and so satisfying.
So good. Look at this one.
I had a patient, and of course she was very sick and she really didn't want to do anything. Well, one day I told her, hey, look, if you let me shower you, shampoo your hair, I will give you the best manicure for free. I think it's really nice because she was so tickled to death when it was done. Well, before she went home, she told her family member to bring the digital camera because I want a picture of my special nurse. I mean, we just connect. I mean, it's just like little things that took so little time to do. Several weeks later, there was this old gentleman standing by the nurse's station looking for me. I heard my name, and he started crying. He gave me a hug. And then in his pocket, he pulled this envelope and showed me a picture of me and his wife. He said, she died a few days after. But I want you to know, she told me that to make sure to look for this nurse and gave her a copy of our picture together. Just make me feel like, wow, it is all worth it being a nurse.
I came to Intermountain about 3.5 years ago, and I am still astounded at the kind of nursing care that we give and the nurses that we have here. We are incredible. I mean, I have never seen such committed nurses, and so much interest and so much enthusiasm about improving the profession. For me, we're just working on getting better and doing things better, and maybe in some ways taking some time to tell the story about what we do.
One morning after care rounds, I went out to take care of my patients, and I had this precious little old lady. I believe she was about 85 years old, and she was not happy that she was here. And she was even more unhappy when both doctors came through and told her she was staying and some other things that were going on, and she was not about to cooperate with us all. Not from breakfast, not from bathing, not from walking, nothing. She wasn't about to do a thing anybody asked her to do. And I came in and asked her to please, let's get up, let's shower you, take you for a walk. She just looked at me, serious as could be, and said, not till the fat lady sings. So I got down on my knees and I sang to her, just you wait, Henry Higgins, just you wait. And it broke the ice. We both laughed, and we had a delightful rest of the day. And yes, she cooperated for me 100%. If we look for the good in whoever we come in contact with, it always comes back 100-fold. It always comes back.
That's really what our patients want from us. They want the human. They want the person that we are. And sharing that is really what shares our heart with them.
Nursing is really it's based on relationships with patients and families. And I think when we truly focus on those, and it's been demonstrated in the research, we know that there's a positive impact on patient outcomes. It goes back to the relationship that the nurse develops with the patient and family.
Just recently we had a patient that we could not calm down, and we needed to do a procedure on her, so we started singing to her. I looked out the window and what did I see? Popcorn popping on the apricot tree.
A 9-year-old autistic girl that had stepped on some glass and was just absolutely refusing any kind of help. Couldn't get an IV in so that we could give her some chemical sedation to help to relax her.
Every time we stopped singing, she would wake up and start fidgeting, so we continued to sing. And at the end of the day, as I got ready to discharge her back to home, she reached up and she gave me a hug.
So I was really impressed that I could be in a place with the staff, and the administration's attitude was, we're going to do whatever we have to make this person as comfortable as possible.
By a simple act of singing to her, we made all the difference in the world. We made a difficult experience a good one for that patient.
I'll tell you, Intermountain Healthcare is great because they expect that from their staff, their employees, and their volunteers, everyone that's involved here. They tell us that we need to make sure that the patient's health and the patient's needs are the #1 priority.
In the future, you're going to be hearing more and more about relationship-based caring.
We were looking for a model of practice that could fit anywhere at Intermountain Healthcare and build upon the incredible nursing that we have here already. I mean, in essence, it says, know yourself, work with your team, and understand the patients and the families that you're providing care for. Well, I do that differently in a clinic and a hospital. I actually could do that differently on one nursing unit to another, depending on the kind of patients I take care of. Somebody with one-day surgery has way different need than someone struggling with a cancer diagnosis. But the elements of relationship-based caring you can use anywhere.
I think the word there, we need to be there for each other, that we all have insecurities, we all have doubts about ourselves and our abilities, and that we need to look out for each other and really support each other and try and find how, the best in people and how you can accentuate the best.
I was the charge nurse on my night shift, and I had a patient's husband come down to the desk and ask for Maalox because he had indigestion, and his wife had had a surgery that day, and so I know it had been a pretty stressful day for him. So I sat him down and had him talk to me about his symptoms and kind of explored with him how long this had been going on and ruled out some of the more obvious signs of a heart attack. He didn't have any of the classic signs, but the indigestion, and then I did notice that he had little beads of sweat on his forehead. So I suggested that we take a little trip to the ER, and I put him in a wheelchair and took him down to the ER and checked him in, and I had barely gotten back upstairs to my desk when the charge nurse on the ER unit called and told me that he had been in the middle of a heart attack and they had taken him off to surgery. It reiterates to me the importance of taking that moment and being in that moment and listening.
Have no doubt in your heart that the work that you do every day is the most important thing that you could do.
Keep on learning, keep on growing, do it for the sake of our patients. Stay creative, stay interested, stay challenged.
If my nurses were in this room right now, I'd say to them, good job. I'm glad you're on my team. You make Intermountain look great.
My goal for them is that they will have an environment where they can do the best job they've ever done. Our patients win, they win, and really we've made a difference in somebody's life.
It makes me really very proud to be associated with nursing staff who are so willing to go the extra mile for their patients.
This isn't just celebrating nursing for a day or two or a week. It's the stopping to say, wow, thanks for all of it. Thanks for what you do every day, every hour, every minute for the patients that we take care of. And in our busy life, we don't probably give them enough thank yous. So this is a chance to sort of accumulate them all in one week and say, we're here to thank you and to ask you to keep at it and to tell us what you need so that we can help you be better.